Atopic diseases include asthma, dermatitis, and hay fever. Atopic disease is triggered by environmental factors, including air and chemical irritants, allergens and pollen, and even pet dander. It's also genetic, thus often affecting entire households. The more we spoke to our users suffering atopic disease, the more we came to empathize with the continual struggle of maintaining their household to be free from such triggers, and to constantly keep track of what is yet to be cleaned, what needs attention, and figuring out the source of the triggers. So here's where our interactive AI solution steps in. Introducing the Habitracker. Simply add the habits the family wants to track on the Habitracker hub, sync it up to a habit bar, and place it at the location that you need to complete the habit. The habit bar will light up to remind you to complete the habit when you are nearby and show you your progress with how you've been maintaining this habit. Add intelligently curated suggestions for habits which will help to combat your household's atopic disease triggers at the root of the cause. See your progress and experience how consistent, purposeful habits can transform your household. Now, the journey to developing the Habitracker was really one of discovery. We started with secondary and primary research with a range of methods and participants, which we then analysed to outline our core user needs. Our ideation then began, and here the basic idea of the Habitracker emerged based on our research that found that tracking was something users were very familiar with, but almost all came to the consensus of its tedious, unsustainable nature. That's why we developed this system that would seamlessly integrate with our users' lifestyles and take away the pain of manual logging. Now, it was at our stages of prototyping, wireframing, and user testing that our concept really evolved. Progress. We discovered that that was what our users wanted to see. The habit bars are essentially little bars of that motivation that can be placed all around the house, exactly where they need it most, so that when they're at the place they need to complete a task, they can see the bar light up, be reminded of the habit they need to build that good habit, and then be rewarded for it as they see the progress go up. As such, we shifted from simply reporting statistics to focusing in on the progress. In the Habitracker hub, we included interactive monthly improvement graphs and the numbers of habits that were recorded. This, our users said, made all the difference. In addition, the hub displays the best and least performing rooms. Users found this to be especially helpful as they could see exactly where to concentrate their efforts and be motivated to keep up the good work where they were doing well in. Suggestions was another thing that we changed radically. Initially, it was a simple set of hygiene habits that would be generally applicable to most of our users' households. But after our users revealed how difficult it was to pinpoint the root of issues, we knew that this was an opportunity to make it something more. As such, the suggestions features now uses AI to monitor the household to locate the sources of problems, and then goes beyond to identify the action they can take to combat it. This sets the Habitracker apart in that it actively helps the household to prevent against issues and stop it at the source the moment they arise. After more iterative testing and refinement, we finally present the Habitracker as it is today. An innovative AI solution which has great potential to allow atopic disease sufferers to experience a new standard of health, simply by tracking their habits to change their life.